At here.
Let me show you this
and
case.
We're just about out of time, I should tell you. We have time for this.
Let me tell you about Jim. Jim had a lot of tough things in his life, and he really worked hard to come back from them. Family issues, job issues, all sorts of things.
I mean, is that common? It doesn't look good.
You know, it's very common, but you don't see it because these people don't smile. You know, look at people, they take a picture, they hold their lips together. You know, when they laugh, they put their hand over their mouth.
Interesting.
It's really very common. And one thing that I find is when people get implants, and I see them a few months later, I say, how's it going? They say, you know, I don't realize how I used to always catch my smile. I used to put my hand up over my face. It became an unconscious habit to hide their mouth because they were ashamed of it. So this patient had come back from a lot. He had family issues, job issues, all kinds of things. He really had hit rock bottom. And, you know, when you hit rock bottom, your first priority isn't your teeth, unfortunately. We have to get our lives back in shape. And he got his life back in shape, and his teeth had fallen into terrible disrepair. All the top teeth were loose. They were discolored. The bottom teeth were loose and discolored. And, you know, he came in and he said, you know, I'm working now, but I can't get the kind of job I'm qualified for. And he was a computer person. He couldn't go into an interview and smile and feel presentable and feel confident. He came into the office, again, with his general dentist.
So his teeth had to go. These teeth had to go.
The top teeth couldn't be saved, and the bottom front teeth couldn't be saved. The bottom teeth on the back we were able to treat.
Okay.
So he came into the office. Again, there were some planning visits with the dentist in terms of what he was going to have. Came into the office in the morning, took out the teeth, put the implants in, temporary bridge was ready to go. He walked out of the office, beautiful teeth, felt like $1 million. What
does the guy say to you?
Oh, you don't say it, they hug you. You know,
right?
There's nothing I ever did as a dentist. When you do a beautiful periodontal procedure for someone, rarely do they hug you. But I don't care who the patient is, they're so grateful that you had this technology, that you brought it to them, that you explained it in a way that they could appreciate it, that they could see the value in it. And almost without exception, these people say, you know, you changed my life. I feel like I did 20 years ago.
So it's not all or nothing. Like, how many implants did it take to clean this guy's smile up?
Well, in the top, it only took 6 implants. We replaced 12 teeth on 6 implants, and in the bottom, we put 2 implants in the front and replaced the front 6 teeth on 2 implants.
So was it like fixed, upper and lower fixed?
Both bridges are fixed in place, don't come in and out. So he left the office that day looking better.
Do you have an after shot here?
I do, let me show you. Here's his before. Here's how he left the office that day with his temporary crowns in place. Smiling, beautiful white teeth, strong, eating whatever he wanted, and he just felt great.
Good. Final message. Somebody out there missing teeth or all their teeth, and maybe they're happy with their denture. What do you say to them?
Well, you know, if they're happy with their denture, in the end we like to make people happy. So if they're truly happy with their denture and they're functioning fine, maybe dental implants aren't for them. But, you know, I've seen a lot of dental patients who are really suffering, implant patients who truly suffer. And they're suffering because they lost their teeth, their confidence is gone, they can't eat like they used to. I can't tell you how many people have cut back on their social life. Seniors don't go out. You know, one spouse has teeth, the other doesn't, and the one without teeth doesn't want to go out to eat because they're embarrassed, so they've cut back like that. Or maybe someone who avoided getting a consultation because they thought they couldn't afford it. Or there's always the patient who, doing like we would all do, put our kids first, put our family first, and never want to do for ourselves, and then get to the point where they're in a crisis, situation. So they're embarrassed about their teeth. They don't feel confident about their teeth. They don't like how they look. 70 is
not too old. 75 is not too old.
No,
that's young today.
It is young. And what's terrific to me is, these people, a lot of them eventually, go to their dentist, or they come to my office, they have a consultation, they say, geez, you know what, I can afford these implants. They're not as expensive as I thought. The procedure is quicker and easier than I thought. A lot of these people end up, having the treatment, and without an exception, they come back and they say, I feel 20 years younger. I feel great when I smile now. I feel I can socialize what I want. I don't gag on my denture. I don't have to put denture adhesive in again. I've had spouses of patients tell me that their spouse's personality is like it was 20 and 30 years ago.
Their personality changes just because of their teeth.
Yeah, when you're living under a chronically miserable situation, a lot of people don't like to complain, so you don't always complain to your spouse. Typically what the spouses say to me, I never realized she was so unhappy, or I never realized he was so unhappy.
Is that right?
He never complained to me. But she laughs all the time now, she smiles all the time now, she wants she wants to go dancing now. So you take someone who sort of slowly became a recluse because of their teeth, and now they're out there again. So what I would say is, if it's something that you're thinking about or you're bothered with these things, talk to your dentist, get a consultation, find out if it's for you, and make a decision based on, the facts. But it's quicker than it used to be, it's less expensive than it used to be, and it's much easier than it used to be.
Great. I want to thank you. And it's not, they don't complain about pain. Nothing to be afraid of.
There's nothing to be afraid of. During the surgery, they're completely numb or they're sedated, whichever they want to be. Afterwards, most people just take a Motrin or a Tylenol. All my grandmother took was 2 Tylenol after the surgery.
She was 91.
She was 91, but I always kid that she was so proud that I was doing her treatment. She probably had all those endorphins. She didn't need any pain medication. But that's all she took afterwards. There's always sometimes some swelling, some bruising. Those are pretty common things. But for the most part, it's one of the easiest dental procedures you can ever have done.
Great. Well, thank you for coming to the show. Very interesting.
Thanks
Very
for
good.
having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Hours. If you would like to watch this interview again online or direct a friend to the interview, you can visit our website at wellnesshour.com. For now, I wish you good health.